I'm Sal Roselli, president of SEIU, United Healthcare Workers West, and the SEIU California State Council, and I've got good news. Today we are as close as we've ever been before to winning real healthcare reform in California. If Governor Schwarzenegger has the will, we have the way to provide affordable, quality health care to more than 90% of Californians as we lead the nation toward universal coverage. A compromise offered last week by Assembly Speaker Fabian Nunez and Senate President Pro Tem Don Parada would control cost while improving the quality of care and reducing cost shifts to workers and overburdened healthcare providers, and strengthening the safety net and emergency services all Californians rely on. This proposal would expand healthcare access by creating a purchasing pool to make healthcare more affordable, by requiring employers to pay a fair share for employee coverage, by extending public programs to cover children and their parents up to 300% of the federal poverty level, and by providing tax credits to middle-income individuals who earn up to $45,000 and families of four who earn up to $90,000. Most importantly, it would make sure that you and your neighbors weren't forced to purchase healthcare coverage that could break a family's budget. As the legislative process moves forward, we need to ensure that this proposal defines an appropriate minimum healthcare benefit, like standard HMO coverage plus prescription drugs, which must be available for 6.5% of your income or less if you're required to buy it. This protection is crucial so that middle-income families and individuals aren't compelled to buy coverage that won't meet their needs and that they can't afford. Families should never have to choose between health care and other everyday necessities like groceries, gasoline, and mortgage payments. The Nunez-Parada plan would allow the Managed Risk Medical Insurance Board to define the minimum benefit package. This simply won't pass the muster of the Californians voting on this ballot initiative next year, so it needs to be changed. There are still a number of other issues to work out in negotiations, like we want to know how the purchasing pool would operate and how the hospital provider fee would also be structured. We also need to ensure that public hospital funding would not be adversely affected. We understand that the Nunez-Parada plan represents a significant compromise for California's working families. However, for a reform package that preserves our core principles, accommodates the governor's key priorities, and moves us so far toward universal coverage, this compromise makes sense. That said, this compromise proposal is very close to our bottom line. We can't increase our risks and our financial burdens with affordability protections that are too weak, nor can we allow employer contribution requirements that are too low and encourage employers to dump their employees into publicly subsidized care, shortchanging the system and making it unsustainable. This plan would allow us to achieve real healthcare reform this year if the governor is willing to accept a compromise. Together, we can lead the way on this critical issue for all Americans. Please join our coalition of caregivers, labor, business, and consumer activists in urging the governor to accept the Nunez-Parada compromise. It's the way to move California forward.